For our innovation project, we chose to focus on nasal packing. Nasal packing is a commonly used treatment for epistaxis or nasal bleeding in patients undergoing elective nasal surgeries such as septoplasty. As you can see by this demonstration, a piece of Nasal packing is inserted into the nasal cavity and is often required to remain in place for 1 to 2 days after surgery. Although routinely used, nasal packing is often associated with adverse impacts on the patient's quality of life.
Research shows that there may be more negatives than positives to using nasal packing. For example, a variety of complications, including headaches, disturbed sleep, and dyspnea, have been associated with nasal packing. Another study comparing the effects of septoplasty, which is a nasal surgery, with and without nasal packing, reports no evidence that nasal packing changed the duration of bleeding was found, which is a problem because that's one of the main uses or goals of nasal packing. Studies have also shown that alternatives to nasal packing, like septal splints and gelatin packing material, are effective, and issues with alternatives such as length of time required for the method and cost have likely led some to continue using nasal packing despite this. However, studies have also shown that the pros of these alternatives outweigh their cons in many cases, and that lack of knowledge of other methods and the issues associated with nasal packing may be a more common reason for continuing to use this method.
For our innovation, we chose to use a three-dimensional print of the head emphasizing the nasal passageway to inform both patients and doctors how nasal packing can adversely affect patients. Demonstrating how the non-absorbable packing is inserted and sits in the nasal cavity for days allows us to inform how such packing can obstruct the air passageway and build up pressure, causing headaches. We are using this model to show how the nasal packing remains in the nasal cavity as well as the removal process of the packing. We want to demonstrate how this may cause pain or discomfort to patients and doctors in order to emphasize the alternatives to nasal packing that would increase the patient's quality of life while recovering from a nasal trauma. Here we are showing the nasal cavity with the expanding nasal packing that demonstrates how it acts in a human's nasal cavity, absorbing blood and mucus, and how that can build up pressure in the nasal cavity, causing discomfort and pain.
In conclusion, there are many alternatives to the traditional nasal packing, and by educating patients on these alternatives, we hope they can be more prepared and educated to choose which method would be best for them. And by being educated on what options are available, patients will hopefully be able to avoid some of the pain and discomfort that comes along with nasal packing.